Hi, my name is Samara Harrell, and I am here to introduce the topic of our new hospital policy. Our hospital policy is regarding hospital-acquired pressure injuries. As you know, these type of injuries occur in immobile patients, and they happen because these patients experience poor oxygen perfusion. Some typical spots where you're going to find pressure injuries are in the heels, in the sacrum, and typical interventions are to reposition these patients frequently. The purpose of our new policy is to emphasize early detection, assessment, and prevention of hospital-acquired pressure injuries. This is important because prevention and early detection are much more cost-efficient than treating these types of injuries later on. Some background on hospital-acquired pressure injuries is that not only do they affect patient quality of life, they are very expensive to treat. For each pressure injury that develops to the severity of a full thickness wound, it costs about $70,000 to treat for each pressure injury. This adds up when insurance companies do not reimburse hospitals for the cost of these types of injuries. This is because they are preventable. Research has shown that prevention interventions are effective at reducing overall number of pressure injuries. And because of this, we should take note and intervene with our own treatment plan. The scope of this new policy is applied to all patients admitted to our intensive care unit. It also applies to inpatients of the medical surgical floor. The goal is that once high-risk patients are identified, healthcare teams will collaborate to initiate bundled care. However, that said, nurses are especially responsible for initiating both new policy procedures and maintaining already established prevention techniques. This is because it's both feasible for nurses and also part of their responsibility overall.
Hi, my name is Maddie, and I'm going to be introducing our hospital's new policy. So it is the policy of NLC Hospital to proactively identify patients with a high risk for obtaining a hospital-acquired pressure injury and to implement a comprehensive prevention plan for this group of patients. The early recognition of the risk for hospital-acquired pressure injuries not only enhances the overall quality of patient care, but also reduces the substantial financial burden that these events can cause. The following procedures outline a framework for utilizing the Braden Risk Assessment Tool to guide the implementation of prevention protocols upon identifying these patients that are at an elevated risk. The first step in the procedures is for the nurse to perform the Braden Scale Assessment upon admission of all patients. Any patient who has a cumulative score of 18 or lower will be identified as having a heightened risk for hospital-acquired pressure injuries. This assessment scale evaluates patients based on 6 factors, including sensory, perception, moisture, activity, mobility, nutrition, and friction and shear. Studies have shown that this assessment is effective in identifying the risk of patients for a hospital-acquired pressure injury.
Hi, I'm Kaylee with the NLC Hospital, and today I'll be explaining the skin assessment procedure. So first, we require that each patient gets a thorough, meticulous skin assessment upon admission. This is important for having a baseline assessment of our patient's skin condition. We also require that there be daily inspections and assessment of the patient's skin during their inpatient stay. All findings should be documented, such as skin temperature, color, turgor, moisture status, and integrity of the skin. And any changes to the original findings should be documented promptly. We also advise that we have additional assessment during skin exposing activities such as showers, bed baths, pericare, and brief changes. We believe that following this established skin assessment protocol is vital to uphold the optimal skincare standards and mitigate the potential developments of hospital-acquired pressure injuries.
Hi, I'm Mackenzie Stones. The step 3 of our Happy Prevention Protocol is to initiate a support system surface onto the patient bed of patients who have a Braden scale score of 18 or lower, meaning that they have a higher risk of developing a HAPI on our unit. So what this entails is that nurses, when they assess the patient's skin and their Braden scale score, they will initiate a support system. This can either be a mattress or a mattress overlay that depressurizes the patient's body and allows for the same pressure to be on the whole surface of the bed. Basically, it takes pressure off highly pressurized areas on patients' bodies where they're highly likely to develop a HAPI, such as their heels or their sacrum. In addition, this is one of the highest ways to prevent a HAPI, as one of the main issues of developing a HAPI is that there's a lack of pressure redistribution. So the support system allows for pressure redistribution for our patients, decreasing their chances of getting a HAPI.
Hello, my name is Gloria Arredondo, and I will be introducing to you the last step in our procedure for our hospital policy. As a last step, the nurse will place a wearable sensor on the patient's chest, like always, safeguarding the integrity of their skin. And this wearable sensor will be monitoring the position of the patient, as well as the inclination at which it was left on the previous repositioning session. The reason why we're adding this wearable sensor is because of the lack of compliance with the protocols that we already have in place. The way the sensor works is because it uses a software that it's called a middleware, and this is what makes it possible to connect the wearable sensor between the patient and the nurse's personal device. This is the last step in our procedure.
And HAPI prevention is essential to utilizing the healer's art. Jesus Christ always offered holistic care. He never just took care of a sin or one thing that someone did, but he took care of them in all aspects of their life. He never left them needing or wanting more, but he left them whole. And as we take care of our patients, not only helping them with their disease or their diagnosis for why they're at our unit, but making sure that we are preventing HAPIs and that we are allowing them total comfort, that is how we can truly be like Jesus Christ and initiate the healer's art with this prevention protocol for HAPIs.